Hello everyone, it's Dr. Durst with RevitalyzeMD, and we're going to talk a little bit more about threads. I have another video of a thread procedure, and I'm going to talk to you about what's being done as we watch the video. So again, threads are a hot treatment of 2021, and it's one of my favorites. And it's something that we do on a daily basis. We have patients coming from long distances, and we have patients every day wanting threads, and they're addictive. So just know that. But a lot of people are actually scared of threads because you watch some of the videos and they don't look like it's that comfortable, but really they are quite comfortable. And so that's why I want to walk you through this video so that you can see this patient getting it. And this patient was actually getting threads, multiple threads in the face and the neck during one of our trainings. And we did another video because in that training I had threads done for the first time. And I've been doing threads for almost 5 years. And I was doing them and my staff is assisting, and they're assisting all day long. But I wanted them done, and I really wanted a trainer to be able to talk to them while they're doing them on me alone for the first time. And also the training and bringing a trainer in just adds expertise to the office. We're already doing them. They have me overseeing it. They have me training them. But sometimes trainers have a different way of doing them. We'll learn tricks or tips, and they're doing them in other areas of the country, and trainers come from other areas of the country, so we might find out how they're doing them differently, and it just enhances our practice. And I always love hearing from other professionals on procedures, and especially procedures that are amazing like threads. So we're going to go ahead and walk through it, and I'll talk about threads as we are watching the video. So please like, subscribe, hit the bell, and likewise leave comments on any thread experiences you might have had. All right, so let's get started. Okay, so here is us marking the face for this patient. And so what we're doing here is we're finding what's the best vector for lift for a particular patient. And then we're pulling back. And again, this isn't surgical. Some people will come in and they'll pull all the way back. I want this. And they're lifting all the way up. And it's not a surgical procedure. You're not going to get this super tight lift. It's never going to be too tight. But there's certain vectors that are going to work better for certain patients, and for other patients, it's a different vector. So basically, we're kind of pulling back on the tissue, and we're seeing where we can create the best lift for someone. And we're going to mark the face. And just so you know, some of this is going to be in detail. And because this is an actual training, we're talking to staff, we're talking about different ways of doing it, and the trainer and I are both working with the staff on this particular patient so that, you know, we can just share ideas and tips on different thread vectors and different thread treatment lines. So basically it'll take a little while for us to mark them up, and that's usually the longest time, is really just getting the patient set up, getting them marked, looking at sides, seeing symmetry and asymmetry and where we need to go. So what we're doing is, you see the little circle, that's going to be the entry point, and right now they're numbing those entry points. In this particular procedure, and again, look at that small needle. It is the smallest needle, smaller than even the insulin needles. That's a 32 gauge we're using, and it's just tiny and perfect for this procedure. We put a little lidocaine and a little epinephrine in the lidocaine, just because at the entry point we're putting a needle in to just create the entry point, and sometimes you might get a little bleeding, so epinephrine helps prevent that. So now here we're taking an 18 gauge needle, and she's already numb in that area. You can see she's comfortable. She'll talk through it. She's not feeling anything. And we're just kind of creating that tract and opening up the entry point. And again, we use a little bit of lidocaine. It minimizes the bleeding there. And so here they're doing the second one. And we just need to get underneath and make sure the opening is big enough to accept the cannula. The rest of the procedure is done with the cannula. This is the last that you'll see of the needle, is the entry point creation. And then we're going to use a cannula to numb the tracts, and we're going to see all of that On the video that we did with me, we kind of started with the threads instead of starting with this numbing. So here we are, that's a cannula. So it's blunt, it's not a needle. So it's less traumatic to the tissue. It doesn't cause bleeding. It's not going to go through vessels, and a little bit of lidocaine into the tract. And at the very end, so the cannula, again, advancing it, and when she stops, that very end where she stops, you might get a little teeny bit of burning when we start to infuse, and we just use a little bit of lidocaine. So right here, right there, maybe a little bit of tenderness right at the very end, just because that tends to be the more tender spot that I have seen over years of doing these. But again, not pain. You might just feel a little burning, and it's a very comfortable procedure. And so I want you to take a look at how comfortable the patient is throughout this. You know, you just sometimes we gotta work to get through the tissue. And another reason why this is great to numb the tract with a little bit of lidocaine and a cannula is because if there is a little resistance, sometimes we can use that numbing cannula to break through that resistance. And that's also collagen building as well. You know, we're basically stimulating some collagen anytime we're using the cannula through. So again, they'd already numbed the entry points with the lidocaine and epinephrine. And now we're using the 18 gauge to just create the entry point. And so that's the last that we'll use as a needle. And you can see very minimal bleeding because, you know, at any time we put a needle in to a face or tissue, a needle or a cannula, anytime we create an opening, you could potentially get some bleeding or bruising. It's a possibility always. But again, very minimal with threads. And so it's natural. It doesn't impede movement. It does some lifting. So you'll see, and we'll talk about the threads as we do them. This is the numbing cannula again. So the cannula is going to be advanced down the tract. And so you'll see that sometimes, like occasionally here, you'll get underneath, but you're getting a little resistance. And we never want to be too forced as we're trying to move through the tissue. So and it takes a little while, and you definitely only want to have threads done with an experienced provider and somebody very experienced with cannula, because it takes a special skill to get used to how it feels in tissue. And so right here, and this is not uncommon that occasionally you'll get some resistance, and it's great to have the numbing cannula be the cannula that you have a little resistance with, so that you can numb a little bit as you go, and then you're breaking through that before you actually start to use the thread. And so the worst that you get here is you'll feel a little pulling, you know, and just pushing, and maybe a tiny bit of burning when we infuse the numbing medicine. You can see the cannula is all the way in. She's going to inject a little bit of lidocaine on her way out, and then she'll go to the next track. And it's amazing that, again, the cannulas just don't cause pain like needles do. It is blunt. You'll see at the end, I think this next one, as she goes in, you can see the blunt tip. That is not a needle, it's a blunt tip. So it makes a big difference for discomfort for patients and for tissue trauma, because it's just breaking through. It's not going to hit a vessel and puncture it where you get bruising. And so a little bit of numbing there. And then the third track down underneath the neck. And again, so then we're going to move to the threads after this. So threads there different kinds. There's different materials with threads. The most commonly used are PDO threads, polydiaxonone threads, and that is the most common thread used. And there's some other ones that you can use, but I think that some of them, there's one that's a little bit longer acting, but again, I think it's a little too firm, and I don't like that one, and I like the PDO threads. And when you can do a lifting thread, and what that means is it's going to lift tissue. So not all threads are lifting with the lifting threads, and this is one of them. This is a molded one, and it has a little stopper in. The thread's already preloaded into the cannula. They advance the thread into the tissue, press down, twist, and engage, and then they're going to be pulling the cannula out as they're engaging the thread, and the thread stays in place. And then we will eventually cut that thread. But you can see how, again, I want to point out how comfortable she is. She's not uncomfortable, you know, and when you're in experienced hands, that's going to be the case. You know, you can't go to just anyone and, you know, if you're going to look for threads just based on pricing, that is probably a dangerous thing to do, because those people may not be trained at all. You might not even be getting good threads, because quality threads are going to cost money. And then again, you want an experienced person to be doing this. If you go too superficial, it's an issue. If you go too deep, you can hit deeper structures and cause problems. There's parotid glands there, there's vessels, there's muscle you don't want to enter. You don't want to impede movement. So again, experienced hands and quality threads are key. So this is a lifting. So as we get a little bit closer, sometimes you can see, sometimes they're molded, or sometimes, and you don't have to go all the way in with the cannula with lifting threads. If, you know, the area that you're treating is not a full, this is a 4-inch thread, and it's not 4 inches for your vector of lift, that's okay. You can see those molded, that basically is going to grab tissue and lift, so you get an immediate effect. So right now, you see how she pulls tight on the skin right there? So that's normal. We want that. So right there, tightness. We want that tightness, because then later they're going to go ahead. You see it's wrinkled and tight. They're going to pull that skin over the entry point, and then the thread is very deep. And so again, this is a lifting thread, molded, so you get that immediate lift and improvement of nasolabial folds and gelling. And then that thread stays, forms and stimulates collagen elastin over time, so it continues to get better over time, which how many procedures do that? Not too many. And so you get the immediate effect, and it improves over time, and it doesn't impede movement. It's natural. It starts to dissolve, you know, somewhere between, you know, 6 and 9 months. The effects last about a year. And again, but it improves over time. So you get that immediate lift, but again, it's going to form collagen elastin in that vector and get better. And so here they are, they advance the thread. They're advancing the thread right now. You can't see them with the other fingers. And then what they'll do is, again, twist and engage the thread as they come out, and the thread stays in place. It's amazing. Look how comfortable she is. There's been no issues whatsoever. Most of our patients have minimal discomfort with threads, and I've never had anyone that wouldn't come back for more. They all love them. It's addictive, so just know that. And here we are advancing, and then once they advance all the way in, when they get to the final place where they want to be, and again, they've already marked it up, then once they get to where they want to be, and again, you'll get a little resistance every once in a while. That's not uncommon. That's why you go to experienced people. You want to know that resistance is just based on, you know, some cutaneous ligaments and not actually something deeper. And then basically what they'll do is they press down at the very end of the track and cannula. They take the stopper out, they advance the thread, they press down on the end of the track, they turn it all the way, engage the thread, and pull the cannula out, and the thread stays in place. Isn't that amazing? And then again, we'll cut, we lift, we cut, and then she walks out and she could go to work if she wants to, because it doesn't even look like she's had something done. You know, the only thing you have is like a little teeny, you know, remnant of maybe the entry point, and that's it. And so the one thing that you might find, and again, experienced hands definitely minimizes any kind of, you know, adverse effects that you might have with threads. But obviously, experienced hands keep you from going too superficial. That can cause some puckering. If you go too deep, you can get into deeper structures. And so essentially what you want to do is stay in the right plane, and experienced hands are able to do that just based on feel and look. And then you might get some little puckering period if like a thread happens to. I'm going to stop this right here in just a few moments, because I want you to look at how tight the tissue is once they change the angle. Right there. See how tight that tissue is? That is what we want. We want it very tight where the skin is actually wrinkled and tight. And then we're going to cut, and then basically we're going to pull that skin back over the thread, and the thread's buried. That's what we want. Yep, right there, wrinkled up. We're going to end up cutting very tight like that, where the skin is very tight, and then we're going to massage the skin over the thread. The thread's buried. And you're done. And we're going to cut the next one, and then we'll go down to the neck and cut. But again, that skin's meant to be tight. Cut it, and then we'll move that over. You see where it's kind of pulled in and puckered. That's what we want, and then we're going to massage that skin over after it. But you can get some puckering just because of thread, not that kind of, but like after the procedure, within the next 7 to 10 days, if you had something called like a puckering where you could see kind of the thread grabbing tissue, massaging it makes 99% of those go away. And most of the time that's all that's needed is some massaging at home. But if anything does continue, then we can do other things like a radiofrequency heating device that can just smooth that out. Occasionally we need to actually make a small incision with an insulin needle and kind of just loosen up that barb that's catching the tissue. But most of the time there aren't a lot of adverse reactions with thread. So now we're going to go through some before and afters. And so basically I always look at the frontal first, because sometimes the frontal is the most subtle of effects, because again, this isn't a surgery, this isn't filler, where all of a sudden we're replacing volume with a filler. It is a lift, so it's going to thin the face out, and it's going to lift, but it's subtle. So people will notice, but they won't know what you had done. And so if you look at the before and after in a frontal, you look at the corners of the mouth. I mean, what woman doesn't want the corners of the mouth turned up, right? And so that can lift. Sometimes it'll lift the corner of the eye. The cheekbones are higher. The nasolabial folds are improved. The jowling, which is a huge area for women. And again, treating jowling differs tremendously between different injectors and providers, and I think lifting with threads is one of the best ways to improve jowling. So, and then just overall thinning of the face and of the neck. But look at neck and jawline, so much better, so improved. Beautiful way to get a natural lift and something that gets better with time. So basically now you can, and this pairs very well with volume replacement with filler, and also laser, thinning. And I think women should be doing something to their skin every 4 weeks, especially over 40, but even before that, to stimulate collagen, elastin, to get rid of dead skin cells, and to just find out or sand down fine lines and wrinkles. This, if you look at, again, improvement of jowls, nasolabial folds, higher cheekbones, and a better defined jaw, thinner face and neck. And then you continue to look at other views, and it's the same thing. So just an amazing treatment, and it's natural looking. It doesn't impede movement. It gets better with time. It's addictive, and the only thing is it's not a surgery. You're not going to get surgical improvement. You do need to go into expert hands to get these done, but they do need repeated. It's not a surgical result for 10 years. 6 to 9 months, they'll start to dissolve, usually last about a year, and you're going to repeat, but you don't have the downtime of surgery. You don't have the cost of surgery. And again, I think stimulating collagen and elastin and laser treatments and resurfacing is necessary, even if you're having a surgical procedure. So amazing treatment. Check out the videos. Definitely make sure you check out the video of me having it done. The only thing we left out was we didn't have any numbing for that. Otherwise, I love the fact that you can see me getting it done, how comfortable I am, and I loved sharing that with you. So leave your comments. Let us know if you want to hear anything else, and we look forward to getting your feedback, and I hope you enjoy seeing this procedure from beginning to end. Like, subscribe, share with friends, and just know we're here to revitalize your look, your health, and your sex life. Thank you.